I'm Shachar Tauber here in Springfield, Missouri. I was asked to talk about the Cassini and essentially the integration of our OR with our CATALYS femtosecond laser. I was really pleased because this is something that has been going on now. I believe we're in our 5th year of that marriage between Cassini and the CATALYS. So this has been very good, and we certainly use it every day we're in the OR. So tonight we're going to talk about how Cassini has really changed the way we do cataract surgery. In 2013, we started a program here where we stopped doing cataract surgery with standard manual techniques. And we now, in 2013, converted 100% or close to 100%. Some patients couldn't fit under the femtosecond laser and other rare things, but we now have 3 femtosecond lasers, and we are over 50,000 surgeries with the femto. In the early part of COVID, we were asked to consider the Cassini, and I had a lot of wonderful conversations with members of Cedars-Aspen who were Cassini experts, and I really was intrigued by this device. And it was exciting to see that Johnson & Johnson felt very strongly about the Cassini. And as they introduced their software and updated their software, the Cassini became a part of it. And we jumped on it because we wanted to do something that would be better in the operating room for our staff, for our patients, for the surgeons, and really better for our results. And really tonight we'll talk about how that integration and the ease of use and the ease to the staff allowed us to become better in our results and allowed us to really improve the premium channel of our cataract surgery. But we just are growing well. And this all said is because we've gotten better confidence. The lenses have gotten better. The femtosecond laser has gotten better. And the Cassini really is the bridge to that for our practice. To the left is what sits in the clinic, and a mile and a half down the road is one of the 3 of our femtosecond lasers. We have the luxury of putting our femtosecond lasers in the operating room, so you can see that we'll operate in the bed that you see there, and it just swings over to the left, and that's where our microscope is, and that's where our phaco unit is. So really the patient comes into the room with the cataract and leaves with a multifocal or toric lens properly aligned, and all in, by laying down once. It's really helped us. It's how we started. We realized that we're an outlier, but when we traveled the world and saw some of the practices we wanted to mimic, one of the things that we learned from Burkhard Dick and his group was placing it in the OR would be very helpful, and we had that luxury. So essentially, the Cassini is over the internet communicating directly to the femtosecond laser. So that data is downloaded by the team the day before surgery. So after I left the OR at 4 o'clock, the team is downloading tomorrow's surgeries for the next surgeon. And that's putting in the Ks, and that's putting in all the data necessary. And that really works very well. So this marriage is 5 years old, and it's something that we continue to work with as the operating systems continue. And I see that my good friend Alan Graham's on the call here. He always comes up with wonderful surprises, and we have told him, and he understands that we will continue with the Cassini as we have had that great experience with it. So his software includes the Cassini from the beginning and going forward. Operational efficiency, more confidence in the procedure. Those two, you add that one, the one to the left, the one in the middle, gives you more premium procedures because you're comfortable speaking to them. You're comfortable talking to patients. And we'll use this in post PKP cataract surgery, and with a degree of confidence with this, and certainly the post refractive patients, and the scar patients where we can work with this. It's really been a big part of how we built up this practice is the Cassini marriage to the femtosecond laser. So what does that mean by increased operational efficiency? There's been studies, 9 surgeons with great experience with the Cassini have figured out that up to 18 minutes of time is saved from pre-op measurements all the way to surgical conclusion, where this 18 minutes breaks up to 6 steps before Cassini, 4 steps with Cassini and the COS, now 7.0 operating system of CATALYS. The surgery day is the treatment plan being entered in, the ink mark, and then there's 2 ink marks, and I remember now trying to figure out how is there 2 ink marks. One is for the staff to put it in. The second one is for the surgeon to line the ink mark up to the catalyst so that you could move the astigmatism in the OCT image. And that really was where you were guessing for me. So that those things go away, and now you get your diagnostics. The planning gets lined up directly in as it's brought in for tomorrow already. And then the toric alignment is only done after the procedure is completed. And you look at the marks that the femtosecond laser put based on the Cassini guidance, and you just line up things. It is simple. More confidence in procedure. That's really the key to making my life happy. The accuracy reported in the literature at the ASCRS in 2020, Doug Koch and Wang, really those guys down in Baylor are quite brilliant in this. We've done some astigmatism surgery with them before Cassini with intrastromals, and I'm very impressed by their stuff that they're doing. Accuracy within 0.8 of a degree, 3 times better than manual marking, and surgeon-dependent manual compensation. That is probably what causes post-traumatic surgeon stress, is that I'm manually compensating for something, and it's the ink mark. The work that we had done on when we introduced COS 6 to surgeons was these big blotchy ink marks, and it's like, where would you put the center of this? And that goes away. The laser marks that our catalyst puts on the cornea is within 0.6 of a degree, more than 5 times more precise than manual ink marks. Again, quite good. This is what you want with accuracy. This is where you can feel comfortable, not just in the toric IOLs and the multifocal torics, but your arcuates. And using these arcuates, we use them for up to 3/4 of a diopter of astigmatism usually, and getting that to work well is quite impressive. We'll go a little bit more at times, but we try to keep our arcs to 45 degrees maximum. We'll use intrastromal for them. In our work with Baylor, we found that they're under 45 degrees to be equal. And I like the fact that the intrastromal are not creating any ocular surface concerns. There's certainly no reason not to do this if you're aware of the ocular surface and doing anterior penetrating. And the question that came up earlier was, what's the registration? It's close to 100% with the 9 surgeons involved in the study. We are using that as a target for ourselves, and we think it's a learning curve for our staff. And we'll go on here unless there's a question. Okay, what does that mean? More premium procedures. You have a happy OR. You have staff that gets reinvigorated every time they see a post-op. And now you start putting in new lenses. Some other thoughts from around the country. Jared Younger, who I've only got to know recently, is saying 40% of his toric volumes, basically saying it's related to Cassini. Eric Donenfeld, who's taught us all for years, and being a medical student visiting Manhattan Eye and Ear in, I don't want to say when, 1987. And he has always taken me under his wing. And when the Cassini came out, we were both on the platform for CATALYS. And he says, this is going to be a game changer. And for his practice, it is. My partner, Wendell Scott, really took to this, and he loves the science of it. He can explain those data sheets all day long, but he's right. It did triple our volume.
Do you recommend the Cassini for surgeons who are currently advanced technology or premium IOL users who want to enhance their conversion rates? Or would you recommend it for somebody who, let's say, has only rarely dabbled in premium lenses but wants to start? So which surgeon is the Cassini best suited for?
We fall into the second category. We were the ones that dabbled into it, kind of dragged our, the painstaking mechanism to get a premium lens in a health system like ours made it so that it was more difficult to even have a conversation. So we dragged our feet. So for us, having a Cassini really said, hey, the science is here, the accuracy is here. So for a new surgeon coming out from the protection of residency and fellowship, having a device like this that you can grow with, and have a team that is consistent. The people that work with us have been very good, consistent, and excellent teachers. That is, I would say, this is one of the devices that's worth putting in your OR.